What is a heart attack? Imagine the feeling of your heart skipping a beat. What does that mean? Does it mean anything? Or is it just your imagination? Sometimes a skipped heartbeat isn't anything to worry about. But did you know that sometimes it could be something serious, even life-threatening? That's right. A heart attack happens when blood flow to part of your heart muscle gets blocked. This blockage is usually caused by a blood clot. Your heart works tirelessly every second of every day. It needs oxygen-rich blood delivered through coronary arteries to keep healthy and strong. When an artery gets blocked, the heart muscle can't get enough oxygen. Without oxygen, heart cells begin to suffer and die. Recognizing the signs and acting fast is crucial. Recognizing the symptoms of a heart attack early can save a life. The most common symptom is chest discomfort. This might feel like pressure, squeezing, fullness, or pain in the center of the chest. This discomfort can last for more than a few minutes. It might also go away and then come back. It's important not to dismiss this feeling as just indigestion or muscle strain. While chest pain is a classic sign, it's not the only one. Some people, especially women, older adults, and individuals with diabetes, may experience less typical symptoms. Other common symptoms can include discomfort in other areas of the upper body. This could be pain or discomfort in one or both arms. It might also manifest as pain in the back, neck, jaw, or even the stomach. Shortness of breath is another key indicator to watch for. This can occur with or without chest discomfort. You might also experience breaking out in a cold sweat. Nausea or vomiting are also possible symptoms. The primary cause of most heart attacks is a condition called coronary artery disease, or CAD. This disease involves the gradual buildup of fatty deposits, cholesterol, and other substances on the inner walls of the coronary arteries. These deposits form sticky patches known as plaques. This process is called atherosclerosis. Over time, these plaques can harden and narrow the arteries. This narrowing restricts the flow of oxygen-rich blood to the heart muscle. A heart attack typically occurs when one of these atherosclerotic plaques ruptures or breaks open. When a plaque ruptures, the body perceives it as an injury to the blood vessel wall. In response, blood cells called platelets rush to the site. These platelets, along with other clotting factors in the blood, form a blood clot around the ruptured plaque. This clot can grow large enough to completely block the already narrowed artery. Knowing your vulnerability. Identifying key risk factors. Understanding the risk factors for a heart attack is a critical step towards prevention. Risk factors are conditions or traits that make heart disease more likely. Some risk factors are things we cannot change, known as non-modifiable risk factors. Age is a significant one. The risk of a heart attack increases as you get older. Men are generally at higher risk than women, especially at younger ages. However, women's risk increases significantly after menopause. Family history also plays a crucial role. If you have a close relative like a parent or sibling who had heart disease at an early age, your own risk may be higher. Having a personal history of certain conditions like diabetes, where your blood sugar levels are consistently too high, is another non-modifiable risk factor. High blood pressure, also known as hypertension, is a major contributor to heart attacks. If you have this condition, your risk of a heart attack is elevated because the constant strain on your artery walls makes them more prone to atherosclerosis. Certain conditions like congenital heart defects, coronary artery abnormalities, or past infections can also play a role. Being overweight or obese is a significant risk factor. Excess weight places additional strain on the heart and can lead to high blood pressure and abnormal cholesterol levels. These risk factors are essential to consider as they offer insights into your personal risk profile. By understanding what you cannot change, you can focus on what you can modify to keep your heart healthy. Empowering your health. Proactive steps for prevention. The good news is that many heart attacks are preventable. Taking proactive steps and making healthy lifestyle choices can significantly reduce your risk. One of the most impactful changes you can make is to adopt a heart-healthy diet. This means focusing on eating plenty of fruits, vegetables, and whole grains. Choose lean proteins such as fish, poultry without skin, and beans. Limit your intake of saturated fats, trans fats, cholesterol, sodium, salt, and added sugars. Reading food labels can help you make informed choices. A diet rich in nutrients and low in processed foods supports overall cardiovascular health and helps manage weight. Regular physical activity is another cornerstone of heart attack prevention. Aim for at least 150 minutes of moderate intensity aerobic exercise per week. This could be brisk walking, jogging, swimming, or cycling. You can break this up into smaller, more manageable sessions like 30 minutes a day, 5 days a week. Strength training exercises at least 2 days a week are also beneficial. Exercise helps control weight, lower blood pressure, improve cholesterol levels, and reduce stress, making lifestyle modifications like quitting smoking if you do. Reducing alcohol consumption and managing stress can further decrease your risk. For individuals who already have heart disease, following your doctor's recommendations, taking prescribed medications, and monitoring your health closely are vital. Knowledge is power when it comes to preventing a heart attack. By understanding the risk factors, embracing preventive measures, and working closely with your healthcare provider, you can keep your heart strong and healthy for years to come. Remember, it's never too late or too early to invest in your heart health. Your heart deserves every bit of care and attention you can give it. So take charge of your health today and ensure that your heart continues to keep you going tomorrow.